Good morning, everyone. Thanks so much for coming. We'll just get started now. I think there's still people coming in, but they can join us whenever they settle in. So thank you so much, everybody, for joining us today for this event, recognising the mental health needs of LGBTQ plus women. You're all very welcome. My name is Faye White. I am the Women's Health Officer at the National Women's Council. And along with my colleague, Alana Ryan, we jointly run the network with Louise O'Leary and Elaine Donnelly in St. Patrick's Mental Health Services. So I know some of you here today are members of the Women's Mental Health Network and some aren't. So for those who aren't familiar with us, we're a network of both people and organisations with a committed interest in women's mental health issues. And we have two aims. So the first one is information sharing and networking, and the second one is advancing interdisciplinary and multi-agency collaboration on women's mental health issues. So before I hand over to our chair for the day, who is Linda Curran, and Linda is the social work team leader at St. Patrick's Mental Health Services, who has kindly agreed to chair this morning's event. I'll just briefly outline the plan for this morning and some of our expectations as well, as per every Women's Mental Health Network event. So as I said, I'll hand over to Linda and she'll invite our speakers one by one to come on. We'll break, they'll speak for about 10 or 15 minutes each, and then we'll break for about 5 minutes at around 10 to 11, just for 5 minutes, just to, get a coffee or tea or whatever you need, before coming back for a Q&A at the end. And then we aim to finish up by 11:30. So, don't be afraid to put any questions in the Q&A box. This is really a space for being curious and learning how to be more inclusive in your practice or in your work. So, as I say, don't be afraid to ask any questions, even if they're ones that feel very obvious, as long as you're being respectful of our speakers and other attendees here. Just to say as well, if you need closed captioning, you can turn it on. It should be at the bottom of your screen in live transcript, and you can just turn that on for yourself if you do need captions for the event. So I think that's everything. So now I'll just pass over to Linda, who will just give a bit of an introduction before introducing the speakers. So take it away, Linda. Thanks a million.
Thanks a million, Faye, and thanks very much to the Women's Mental Health Network for inviting me to chair this morning's event. Kind of an honour of pride and looking deeply at some of the issues that might affect women and their mental health in the LGBT community. So I'm a social work team leader, and for the past 15 years or so, I've been working across a range of community and addiction services and mental health services. So as a mental health practitioner, I'm very interested in ensuring that there's equitable access to services and that we're being very sensitive to the unique needs of minority groups, particularly the LGBT community and some others as well. And, we know from the research and we know from experience as well that sometimes people in the LGBT community, they're going to face significant challenges compared to their heterosexual peers. So we have a range of speakers and I'm really excited to hear what they have to say on some of these issues as well. So we're delighted this morning to be joined by Paula Fagan. Paula is the CEO of LGBT Ireland. This is the leading organisation. She leads out on supporting staff and volunteers. And Paula, for those of you that aren't familiar, she's been involved in LGBT activism for many years. She holds an MA in Women's Studies and she's just recently completed HDIP in psychology as well. LGBT Ireland is a national support service for the lesbian, gay, bisexual and transgender people and also their families and their friends, and it was established in 2010 by a number of local LGBT helplines. So currently LGBT Ireland offers a range of comprehensive services around support and information around sexuality and gender identity, and one of those is the LGBT Champions programme, and Paul is going to be talking to us a wee bit more about that today. So good morning, Paul, and thanks very much for joining us.
Good morning, Linda, and thanks a million to the Women's Mental Health Network as well for the invitation. I'm absolutely delighted to be here.
Brilliant. So Paula, could you tell us a wee bit more then about the LGBT Ireland Champions programme and what does it aim to achieve?
Yeah, so the LGBT Champions programme, it's a training and networking program, and it's aimed at health and social care professionals working with older people and in older people services. So we set up the program in 2018. It's basically the training element is to build health and social care professionals' confidence, knowledge and skills around working with older LGBTI people. But also we ask the champions, once they're trained, then part of the program is that they develop an action plan. So they really become drivers of LGBTI inclusion back in their own services. So I think that's really been the success of the program, is that we regularly engage with champions, so they really do go back and start a program of work in their own organizations, and that seems to have been very successful in terms of raising awareness of LGBTI issues, but also then just building a much more inclusive place, service, organization. So a lot is one of the unexpected outcomes of the program is that a lot of staff, for example, will come out to champions after they go back into their services. So that's a very interesting aspect of the program as well. I know I don't want to, so I don't know how much time to hog, but I suppose just to give you a little bit of background as to why we set up the champions in the first place. So as you mentioned, we run the National LGBT Helpline since 2010. So just over 5% of callers to the helpline would be aged 55 and over. And generally speaking, older callers phone us because of loneliness and isolation, and pretty much most callers at that age bracket would be experiencing mental health difficulties. And that's very much in line with, there's not much research done in Ireland into the experiences of older LGBT people, but the research that was done by Trinity in 2011 would have found that quite significant mental health challenges with that age cohort. So 10% of people in that study would have been seriously thought about ending their own life, and 5% would have self-harmed in the year that the research was done, but only 2% access services, mental health services. So we were seeing it in the helpline, we knew the research was there. So we did a consultation in 2018 with a range of national and regional services, including mental health services that work with older people, and pretty much by and large the services were saying we don't have LGBTI people visible in our services. Now, the good news was at that stage, that was post-marriage equality. So a lot of organizations realized that there was something wrong with that statistically the people had to be there. So I think that really gave us the motivation and a lot of positive engagement then with service providers. People were anxious to get training. So that really propelled us on to set up the program.
Yeah, I suppose we've had a huge amount of different social change, and it's so interesting to hear about a program that really gives support and back into healthcare professionals that are working in this area to be agents of change, because we know that change is an ongoing dynamic process. It's not so simple as we're going to, raise a flag and then that's it. It's something that we have to work on, and unfortunately, I'm not surprised to hear that around work colleagues been more likely to come out, but really heartened to hear, because we know about 40% of people choose not to be out for various reasons. So it's fascinating then that something like this, when we're focused on patients, that it'll have a knock-on effect for staff and other people around us. So Paula, focusing on then a little bit more on the older LGBT women and their access in the health service, and specifically mental health services, what do you think is important for us then as mental health professionals to be aware of? What are some of the key needs that we should be aware of there?
Yeah, so obviously it probably goes without saying, but older LGBTQ women will have the same issues as generally as women will have as they age. So I think invisibility is one, social isolation perhaps, and so on. But so some of the unique, probably the top 3 unique challenges we would see is firstly fear of accessing healthcare, because they really genuinely fear they're going to get a negative reaction or they're going to be discriminated against. So that's evident in research, but it's also evident, we know that from all our dealings with older LGBT people and women in particular, And that, I suppose you have to think about it in the context of anyone. So I'm 52, right? So I grew up being gay in the 80s and 90s, and it wasn't easy, but I suppose I'd be on the cusp of change, if you like. But anyone who's 60, 70, 80, 90, they've lived through a time where their identities were pathologized and also criminalized to some degree. So that has a huge implication and impact on them, and they will have lived through in an Ireland that was very socially unaccepting of them and stigmatizing of them. So we are fearing the worst, and older people are fearing the worst when they access services. So I think the main thing, and I know we're coming to that in a little while, is that to encourage an older LGBTQ woman to come out to you, or to be herself and to be open about all of herself to you, the service really has to be very tangibly inclusive and safe, because people have a very deep fear of being discriminated against or having a negative reaction. So that would be the top issue. And certainly for people who are older, even activists, that's one of the most surprising things to me, is even people that have been very out in their lives are talking about going back into the closet in certain circumstances. So that is quite serious and shocking, really. The second thing would be around it's very likely that an older LGBTQ woman will have been married in a heterosexual context. So that certainly one of the services that we run is the Married Women's Group, and a lot of the women through there would be in their late 50s, 60s, 70s, and either they didn't realize their sexual orientation or gender identity because there was no reference points when they were growing up, so they ended up being married before they realized that side of themselves, or they just couldn't come out and they got married, or they came out later in life, or maybe they realized it later in life. So that can be a really difficult, complex situation. When you're married, you have to come out to your children. Obviously, it's very difficult to come out to your spouse in that situation, and then to in-laws and family members. So it's a very difficult and complex situation, and it takes a lot of support, in my experience, for women to navigate that situation. And so again, as healthcare providers, if somebody presents to you, it's about who do they want as their next of kin, who do they want to be their advocate, and so on. So just to be conscious of that, because it can be often quite a complex situation where their husband may be their legal next of kin, and so on. The final thing then, I suppose, and this comes up in the research, is disenfranchised grief. So older LGBTQ women, they probably will have experienced, for example, significant relationship breakdowns, as we all have, but they weren't acknowledged, or they may have had this terrible loss in their life which wasn't acknowledged or spoken about. Similarly, we run a telefriending service for older people, and some of the women we're supporting at the moment have lost their life partners. And going through that awful grief and the huge event that is, and they don't get the same recognition or social support in very subtle ways. They just don't get that same acknowledgement, say, that other people do, and the outpouring of social support when it is a same-sex partner. Even still, that can be the case, and you hear from people, people say, "Oh, I'm sorry, about your friend," and so on. So it's just not recognized, and the support is just not there in the same way. And then around children as well, I suppose, even up until now, we don't have legal recognition, parental recognition, for many same-sex headed families. So a lot of older women will have raised children, will have been our parents, but their parental relationships with their children are not recognized. And sometimes, unfortunately, where there's a relationship breakdown, we support women who don't have access to their children because they've no legal right to do so. So all of those things add very difficult and can have a huge impact on mental health in an older woman's life. And it just means that they're very diminished support networks. So that would be the kind of overarching piece then to come out of all of that.
Yeah, absolutely. Very poignant and reminder there, Paula, that even though we've had these many legislative advances, they are very, very recent, and many of these things are in living memory. So as clinicians, it's important to unpack that a bit when we can with our assessments with the patients as well. So finally then, Paula, I might just ask you, in your own view, what do you think that mental health services need to do to become more inclusive, more responsive to the diverse needs that you've mentioned of LGBTQ women?
Thanks, Linda. Yeah, so as we were talking about earlier, we launched the LGBT Voices Matter research on Tuesday in partnership with Mental Health Reform, and that was research with LGBTI plus users of secondary and tertiary mental health services. So a really good piece of research there to have a look at. And one of the standout things that why we did that research, or why mental health reform were so driving of that research, was that 1 in 5 people accessing secondary and tertiary care are likely to be LGBTI plus. So that's a huge cohort of service users. So every 5th person in your service could be LGBTQI plus. So that's the first thing in terms of just thinking about that and are you equipped and inclusive of that cohort? So that's a very important thing to consider given the numbers. And then I think what came out of that research really was that where there was sensitivity and competence, where that was really clear in the health professionals. So where the research respondents, the positive experiences was where the health professional was obviously competent and sensitive and trained in LGBTI issues. And that was a really significant moderating factor in terms of the service users' experience and also recovery. So it does make a difference. I think the research really clearly points to that. And unfortunately, the converse was true as well, where there was a negative experience where the healthcare professional was insensitive or didn't affirm or just didn't have the knowledge. Then it had a huge knock-on effect. So that's really the fundamental top-line issue to come out of that research, is the need for policies and practice, and particularly training. Because as this is highlighted here, there is certain things that you wouldn't necessarily think about, but has a cumulative effect on the older person in this case, that you really need to be aware of as you're taking their history and thinking about their recovery plan.
Yeah, absolutely, and those diverse needs there as well. So thanks very much, Paula. And I just remind participants as well, you can use the chat box for Q&A. We will be coming back to that later in the session, so we'll invite you back then. Thanks so much, Paula.
Thanks, Linda.
So I suppose moving on then maybe to a different age and stage of life where we consider youth. And if we think statistically, if you're an LGBTQ person, it's unlikely that you're growing up in a home with other LGBTQ people. So it's not likely that your parents or your siblings are also going to have this shared experience, or that you can build and share your culture and share a common understanding with them about the experience of being LGBTQ. So when we think of youth, it's so important that they have their own defined spaces and the chances, their identity to explore that and to have that peer support as well. So I'm really delighted that our next speaker could join us. So Moninne Griffith is the CEO of Belong To Ireland. That's the national organisation that supports lesbian, gay, bisexual, transgender and intersex young people. For those who aren't familiar, Moninne is a passionate social activist with over 20 years experience in the fields of advocacy, law and social justice. As CEO of Belong To, she's dedicated to supporting and empowering LGBT youth and achieving a world where they're equal, safe and valued into diverse identities. Moninne is involved in many committees, including the government's task force for youth mental health, and she's also a former chairperson of the National Women's Council of Ireland, and currently she sits on NIMIC, which is the National Implementation and Monitoring Committee for sharing the vision and mental health policy for everyone. So good morning and welcome, Moninne. Thanks very much for joining us today.
Good morning, Linda, and good morning, everyone. I'm delighted to be here with you, and happy Pride.
Happy Pride indeed. So maybe just to get us started then, Moninne, could you tell us a little bit more about the work that Belong To does?
Sure. Well, we were founded in 2003 by our founding director, Michael Barron, and some other activists who were working in the community in Dublin city centre at the time, and noticed that a lot of young people coming into homeless agencies were young gay men. So it was Belong To was set up really to provide a safe space for young gay people to be able to be themselves and find community and find peer support. Since then, we've grown and we're now quite a big organisation. We run 5 different groups, including a young LGBT gals and their non-binary pals group called the Ladybirds. And we also support over 50 LGBT groups across the country. We do a lot of work around in the education and training space, especially in post-primary schools. And we do a lot of advocacy work and communications and media work as well, and campaigning. So a lot of our work would relate to mental health and well-being, because it's such a big factor, a big presenting issue for young people who come into us, who may have experienced family rejection, bullying, isolation or exclusion, or just regular everyday identity-based trauma from being LGBT and growing up in a society that, despite how far we've come, really does have conscious or unconscious bias against LGBTQ people, and sometimes that's very much internalized with people. So coming out distress can be huge, especially amongst younger LGBTQ people.
Okay, very good. And can you tell us then, Moninne, a little bit more about the particular experience of these young LGBTQ women that are accessing your service around the mental health side?
Sure. So as I said before, I mean, the most common issue that they would talk to us about when they come into us is the fear around coming out. So fear about family rejection, fear about rejection from their friend circles, fear about being bullied in school, and the statistics show that they are likely to be bullied in school. Our survey of young people in 2019, the School Climate Report, showed just how unwelcoming schools can be. So 74% of LGBT students said that they didn't feel safe in school, and they described a wide range of bullying, from everyday casual homophobic, transphobic language, right up to physical and even sexual assault because of their sexual orientation or gender identity. So school can be a really tough place to be. And what we found as well, especially in relation to young women, is that if they were gender conforming, so if you were a young lesbian, bisexual or queer woman or indeed trans woman who looked and acted like what was the expected norm of a girl in that school, you were less likely to be targeted, whereas girls who were more masculine or more didn't fit the role, the gender norms of that particular school, you were more likely to be a target of bullying. And so yeah, it's really tough still to be LGBT and growing up in Ireland. And of course, all of these are risk factors for mental health. And so, we still, thankfully, we work with great partners like Pieta and My Mind and lots of other great mental health providers who are realizing that they need to take active, positive actions to really make sure that LGBTQ people know that their services are friendly and inclusive, and indeed that they are deserving of help around their mental health. What we find is, for a lot of young people, that their help-seeking behaviour, they're not great at that, because a piece of research we did a number of years ago, we found that LGBTQ young people feel that almost it's a part of being LGBT, that they might struggle with mental health. They also feel a little bit guilty about it, you know, post marriage equality, post gender recognition. I shouldn't be struggling, or sure, aren't we great? A lot of younger people as well, because of the barriers of getting access to mental health supports, don't feel able to talk to parents about, you know, the fact that they may be self-harming or feeling suicidal. They feel, you know, I've already broken their hearts coming out as LGBT. I don't want to now put this extra thing on them by telling them that I'm really struggling and that I need their consent to get access to a mental health professional. And so the masks that LGBTQ people have, that we all have, for our safety, in terms of masking our sexual orientation or gender identity, that work very well, keeping us safe in our everyday. Unfortunately, sometimes those masks are used to hide what's going on for us in terms of our mental health and well-being. So it can be quite tough realizing that somebody LGBTQ is struggling, because they're very good at masking or hiding that. So on social media, they might be really happy and looking like their life is fantastic, but behind the scenes they could be really struggling. So all of these things make it even more difficult for us to persuade LGBT young people that there are services available to them, and you know, that they should come forth and they deserve the help that's out there for them, and they're not taking up anyone else's space, that these services are there for them, and they deserve that. And being LGBT isn't a life sentence for struggling with your mental health. Yes, you're at a heightened risk of it, but there's so many things that you can do to help yourself, and so that we're constantly trying to get that message out to LGBT young people.
Yeah, I think that's really interesting what you're saying there, Moninne, about that they can almost feel like guilt that we've achieved some kind of glorious endpoint with marriage equality, and maybe the challenge there for services and for society in general is to appreciate that it's a process and there's a journey, and that there'll be different things, and that just because we've had some advances doesn't mean that all solutions have been, and that things will emerge, and also the powerful image there we have of the mask that young people feel they have to adopt and to conform, and we know that can be quite contrary to the authenticity that's needed for mental health recovery, as people are accepting who they are as well. So I might think back a little bit, and maybe the dreaded pandemic, if we talk about that a little bit more. But we know that disproportionately this impacted on young people. It was their debs, their graduations, their impact of starting college, totally different to perhaps what they expected, and especially if they were planning on that transition into college life, that they might be able to embrace themselves somewhat more. So I'd be interested then if you could tell us a bit more about the mental health impact on young people you work with, and what the learnings from the pandemic have been in relation to youth LGBT mental health.
Yes, we ran 2 surveys in 2020 and 2021 with young people to gauge what was going on for them, and like you said, the pandemic turned everyone's world upside down, but for some cohorts of the population was even worse. And for LGBT young people, some who weren't out, or some who were out but were in a home that wasn't accepting, it was an extremely stressful time. So it was like a pressure cooker. And some young people have described it as, being forced to come out, not having the luxury of having a bit of time to process it themselves, to adapt and play around or explore with, before they have to come out to a parent, family member or a carer that they were living with, and feeling quite resentful of that. A lot of young people described that mental health issues that they would have experienced in the past had resurfaced. So incidences of self-harming and suicide ideation increased vastly, and the usual outlets, I suppose, in terms of peer support, community, you know, even exercise, being outside, all those things that we would count as coping skills, especially in the LGBT community, having your peer support groups to go to, weren't available. So there wasn't those pressure valves to reduce the heightened feeling of anxiety or depression that some of the young people were feeling. So it was a really, really tough time. You know, and very tough for some of the workers as well, supporting young people. I know there was one youth worker we were supporting who had lost 2 young people in her group within the space of a couple of weeks to suicide. They died by suicide. So it was a really, really a tough time, and I think we're probably going to see the fallout from that time for some time to come. But thankfully now that we're back face to face, you know, there's more option, and we continue to be able to use kind of a hybrid option as well for some young people. It's not a possibility to get to their local LGBT club because they live in a rural part of the country. It'd be easier for them to get to Dublin than to the main town in near them, or there mightn't be an LGBT group in their county. But so there's online resources available for them. So there's some things that we have learned to do better, and support young people better. But I suppose back to what I said before, it's constant challenge for us just to get through to young LGBT people that it's okay not to feel okay, and that you deserve to reach out and get the support that you need, and learn the coping skills that you know, that professionals can help you learn to cope with the everyday things that are going on. Also, things that happened recently, you know, in the community have had a huge impact on LGBT young people. So the tragic murders of the 2 gay men in Sligo earlier this year, some of the hate speech online that's been happening recently. All of these things take a huge toll on LGBT people's mental health and well-being. People have to be aware of that there are consequences for when you or rather there mightn't be consequences, but your what you say and what you do can have an impact on people around you, whether they're online or people offline in your community who mightn't be out yet. Language and homophobic language and homophobic and transphobic behavior and attitudes, all of that kind of thing can take its toll on people around you. LGBT people, we're constantly negotiating our spaces to find safe spaces, to find allies. And that's why things like when we talk about being a safe ally, or when Paula's talking about how practitioners can give visual cues to LGBT people that we're allies, you know, those tiny little rainbow badges or pride flags or something like that in your space or on the back of your laptop or anything like that. For most people, they go completely unnoticed. But when you're an LGBT person constantly looking for who's safe to talk to, who's safe for me to come out to, and I include myself in that bracket, you know, I get into a taxi and I might decide to, you know, when we get into the chat, I might decide to talk about, to be authentic and be myself, or I might decide not to. So these kind of little visual cues are visual cues that it's safe to talk to me, it's safe to be out to me.
Yeah, this is very interesting, Moninne. Can I just clarify as well, I suppose Ireland, it is you know, an ever increasing change in sort of place. The language spoken is changing a lot as well. Does Belong to offer services then, or is there information that's available perhaps to young LGBT people that are like English mightn't be their first language? Do you have any services like that?
Unfortunately, not services. We've lots of information on our website, though, that has been translated into different languages about coming out, both for young people and for parents. We also have free online training that's available. I mean, it was made specifically for teachers and youth workers, but anyone is welcome to do that. And it goes through things like terminology and language. It goes through our unconscious bias. goes through what it's like growing up LGBT in Ireland at the moment, and the research, and then some helpful tips in relation to how to be a good ally and how to support LGBT friends and colleagues, or young people in your service.
Yeah, brilliant. So, I mean, just the last question then that I might pose to you is, what do you think that we as practitioners can do to become more inclusive and responsive to the needs of young LGBT women? I know you've mentioned about the visibility, but is there anything else that you might recommend to us that could be helpful there?
Well, I think it's about education, and I know that many people in the medical profession only get a very small amount, spend a very small amount of time studying about sexual orientation or gender identity in your initial training. So I think it's really important to keep abreast for continual professional development. So to seek out further training, or just to do your own reading. There's so much research out there. You could even start on our website. We've lots of research there, you know, about best practice, how to make your practice more inclusive. I think it's learning some of the language and terminology, keeping your language open and inclusive, around, you know, around pronouns, or, you know, when you're taking somebody's history, being very inclusive about partners and spouses instead of husbands and wife. Don't presume everybody that comes into you is heterosexual or cisgender. A nice way of doing it when you introduce yourself is introducing yourself with your own pronouns as well. That's again a little cue to that person. I see you, I hear you, I respect you, I'm safe to come out to. Loads of other ideas as well. I mean, just to mention a few, you know, I think it's very important as practitioners that we are supportive of and call for gender affirming care as well for trans individuals. There's such a dearth of that, and I know Lilith is probably going to talk more about that, but it's really in a state of crisis here at the moment. So as professionals working within the system, I think it would be great for you to become advocates for that as well. I think knowing about LGBT specific services like the LGBT helpline, belong to, all that kind of thing, so you can signpost patients to us, or family-based interventions as well. I think for a lot of young people, a lot of that fear and family rejection and family conflict can be hugely difficult. And, you know, for you know, some young people, it's trouble in school. So again, if you're working in a community, I think it's great to talk to schools about undertaking programs like the Safe and Supportive program with Belong To, so that schools become safe places. And lastly, I just have to mention the whole issue of conversion practices and efforts. It's really important that professionals in this area stand firm with our community to call for a ban on these efforts. They're so dangerous, and we know from the research that individuals who've been put through these kind of practices and so-called therapies are at a much higher increased risk of suicide. So we have to stand firm on that. It's not therapy if somebody coming into you, there's a preconceived outcome that you're going to stop them being gay or lesbian or trans. That's not therapy, and that's something very, very damaging to somebody's mental health and well-being.
Yeah, well said, Moninne. Thanks for bringing up that important issue. I suppose we've seen some strange things happening in the UK around that, especially with the trans community. So thanks very much, Moninne. Again, the question box is there, and we'll come back to that later. So thanks for joining us on that. So I suppose just prior to introducing our next speaker, when we think of Pride and its origins, it's, you know, people mightn't be familiar that it came from a riot in Stonewall in June 1969, and there was kind of police intimidation around kind of gay bars and some of that, and impacted across, it was a real watershed moment that impacted across the LGBT community, and what was happening is they were targeting people not only that they suspected of being homosexual, but also people that were gender non-conforming, or if they thought they weren't wearing like gender appropriate clothing. So I'm especially delighted that we have a representative on this panel, because there is no LGB without the T as well. So for those, our last speaker then is Lilith Ferrerya-Carroll. She's a National Community Development Officer with the Transgender Equality Network Ireland, and her work focuses particularly on promoting mental health, resilience and capacity building within the trans community in Ireland through community events and liaison with trans peer support groups around the country. Lilith holds a Master's in International Development as well as a degree in Digital Media, and then prior to joining TENI, she was an Overseas Communication Officer for Concern Worldwide and also worked as a videographer. So welcome and thanks for joining us today, Lilith.
Hi, thanks for having me.
Great. So maybe just to get us started then, Lilith, could you explain and tell us a wee bit more about the work that TENI does?
Sure, yeah, a lot. I suppose it kind of to break down, I guess, what the work that TENI does, and it's primarily, I guess, support, training and advocacy. So we provide support for the trans community, if it's adults, if it's kids, it's families, and you know, people going through schools and third level, and then we would also offer kind of training to organizations that want to learn a little bit more about trans identities, as well, including gender identity and skills training for healthcare professionals as well. And then I suppose we would be advocating for trans rights and for especially in terms of legal gender recognition for trans people under the age of 18 and non-binary people, and access to healthcare services as well.
Okay, yeah, and then from all that work then, what do we know about trans people's mental health and access to services in Ireland? What do we know about that?
Yeah, it struck me when I was listening to Paula about how like older LGBT people had been pathologized in the past, and that had caused kind of issues amongst older people. Well, that's kind of what's happening right now with the trans community. We currently have a psychopathologizing model of care in this country, which means that in order for a trans person to access healthcare, in order for a trans person to have bodily autonomy, they need to be pathologized. And this is despite the fact that you know, the World Health Organization latest in ICD-11, the international classifications of the disease, has moved trans identities away from mental health and into sexual health. And so, you know, what we need to be doing is that we need to decouple you know, mental health supports with other trans health supports, because currently what is happening is that in order for a trans person to access bodily autonomy, in order for a trans person to access healthcare and surgeries and those things which should be available in our communities, we have to have a diagnosis. We have to meet and talk to a psychiatrist and a psychologist, and multidisciplinary teams which were designed in the 1970s for people that have severe mental health conditions, and that is highly stigmatizing and also really expensive. So trans people are being funneled into a tertiary service if they wish to access hormones or surgery, when that really shouldn't be the case. And what we need to have is a system where it's an opt-in, where trans people can opt into these services. We know, like I was reading some research recently in Australia, where they have moved to an informed consent model, which is what we would advocate for. And what 80% of trans people did opt into mental health supports, but the satisfaction levels that were much higher, even though the outcomes were just as successful and just as positive in terms of the accessing actual healthcare. And that's what we need to be doing in this country. But unfortunately, it's not the reality.
Yeah, and certainly what you're talking about there is a certain amount of painful masking, which I'm sure must occur if they have to engage with MDTs and not perhaps speaking so freely about their mental health in case their gender identity has been conflated with those issues. So a very painful dynamic must emerge there. So I know you're very involved with peer support, Lilith. Could you explain about the role of peer support in mentoring and mentoring in trans people's mental health treatment?
Yeah, I suppose I would want to kind of see kind of peer support as a sort of mental health treatment. I think that it does definitely benefit trans people's mental health, but peer support for me is about community care. It's about community building. It's about building friendships and relationships and meeting and being able to spend time with your peers and to share experiences. And it really helps in terms of minority stress as well, to be able to be in a space where your identity isn't questioned, where it's not everything that it's about you, and that you can really kind of find camaraderie and build self-confidence and see people that have been through what you've been through, understand it, and people that are, have been able to move forward in their lives, and all these wonderful things. And for me, it's when trans people get together, when communities get together, that can be when the magic happens. It's when and people can maybe move beyond kind of seeing it as a terrible thing or an awful thing or a struggle, but actually something that is beautiful, something that is to be celebrated, something to be proud of. So I think that's really important. And I suppose my role is that I liaise with trans peer support groups around the country, help get them set up, I help with any issues that might be arising. And these are all these wonderful benefits that peer support can have. Unfortunately, I think that what has happened as well within trans peer support spaces is that they've been kind of come a space where people within the community have had to cope with and try to manage and deal with the fallout of the systems that are in place within the wider mental health system, where people are languishing on waiting lists. Now we're looking at up to a decade for adults, where the health system is completely collapsed for people under the age of 18, and all these difficulties. So people are coming in and they're having horrible experiences with their assessments, and having to share that within the group, or they're just languishing without access to healthcare for years and trying to actually be themselves and live their lives with that massive mental burden that really shouldn't be there.
Yeah, so it sounds then like peer support, it's a great opportunity for us to build maybe that minority resilience. You're seeing people and hearing from them that are like you, and you're sharing that experience. But as well as mental health practitioners, we need to be mindful of that. It sounds like an embedded structural trauma. People have been left to wait and not getting the services that they need in a timely fashion, and to be mindful it's not been left too much to peer support to do that side of it as well, that those people need support as well in that space.
Yeah, and it's important to mention as well, it's not just the people that are left high and dry and waiting, it's also the people that are currently going through our systems as well, that are being pathologized as well, and the difficulties that causes also.
Okay, absolutely. And then, Liv, how can our audience ensure that good practice, that we're being inclusive of trans people's needs? What advice would you give there?
I think it's about kind of acknowledging the fact that being trans is not a mental illness, and that being trans is not a mental health condition, that it is a part of who a person is, and there is what trans people call, there's a kind of an endemic issue of what's known as trans broken arm syndrome. So what that means is you go into a doctor and your arm is broken, and the first thing the doctor thinks is it because you're trans? And we need to be able to move beyond this notion that everything kind of links back to one's transness. That's just a part of what a person is, but because it can be so incredibly difficult for trans people to move through the world. There can be issues in terms of how people are treated in society, in their health systems, in their families and communities, and it's these are kind of outcomes of stigma and prejudice within society, and not because of who the person is. And I think it's important to kind of decouple that, but also as well just to have a knowledge of what it means to be trans, and to look at seeing if it's possible to do to learn around what trans identities and what they are, and to be up to speed with the international best practice and around trans healthcare, and to advocate for systems change, I think is really important. And as well as that, I think just to be mindful that just because the person that you have in front of you is trans, that doesn't necessarily mean that that's the reason why they're in front of you. There could be a whole myriad of reasons why they're looking for support and looking for guidance, or wishing to access healthcare. And trans may be one of them. It might be a factor, but it may not be the reason why they're there. So trying to kind of jump to that conclusion too easily as well.
Yeah, well, I certainly love that metaphor of the trans broken arm. I think that's something that'd be helpful for us to point out and bear in mind, that dissociating those things as well. And if we're looking up the TENI website and some of the information that you have, is there an option to translate some of that as well? Do you have services then that are applicable to people that English isn't their first language, or need like sign language, or how has that come up as a challenge in your service as well?
Unfortunately, no, that's not a facility that we have. I mean, I have I do have some information in French, because I had a refugee come to me looking for information on sports, and I had a friend of mine help me to translate it into French for her benefit. But I guess in terms of resources and being able to do that hasn't been something that we've managed to get to yet. But definitely, if there's anyone in the audience would like to help with that, sure get in touch. Would be delighted.
Yeah, we'll certainly talk about going above and beyond. So just curious that I've been mindful that there is probably people with different language needs as well there. So thanks very much for that, Lilith, very helpful and informative. So what we might do now is just take a 5-minute comfort break if people just need to move on that. And we will start back then at 11 if people want to put up any questions, and we'll continue on the conversation then. So we will see you back at 11. Thanks very much, everyone. So I might just invite the panelists to turn their cameras back on as well at this stage. See Lilith there. Just looking at some of the questions that have come in. So maybe just someone had mentioned, we've mentioned and probably dipped in and out of a few different research and reports and websites and so on. So they have been put into the chat function there, so you can have links to that a bit further. And as well, also attending today, we have Ber Grogan from the Mental Health Reform, and she's just put up about a recent research that they did alongside LGBT Ireland. It's some of the details there are around there. So I suppose contemporary Irish research, that's probably the most recent larger scale study, and a really helpful one for us all to read over and see some of the findings there specific to the mental health needs. So that's also in the chat function, and thanks to Bar for attending. So I might just have a wee look at some of the questions that are coming in through the chat function here. But one of the first questions that have come up for our panelists, a person here asking and saying that they'd love to hear more about LGBTQ and mental health during perinatal, pre-pregnancy up to 2 years, and the transition to parenthood. I'm in the early stages building services in this space, and how to overcome some of the inequalities. So
yeah, I don't mind taking that one, Linda.
Yeah, great, Paula.
Yeah, that's a really good question. I think it's something, certainly I was on a panel, there's Trinity College and Queen's, and it did combined research with midwives and all of the universities that educate midwives, and that was published, lost track of time, but last year. And really, it's such an emerging issue, actually, and it's actually driven by midwives, because they're seeing people in the services. So a lot of same-sex female couples, for example, and people with trans identities accessing services. So it's a really good question, a really an emerging, I suppose, area of work, and I think a lot of midwives and nurses are looking for education in this. So I suppose the main thing is, I think the things that come up for people who took part in that research, and certainly our own experience, we work a lot with same-sex headed families, is again the sensitivity piece, the knowledge and skills and legal issues. So just people would say that, you know, they go into the services, will their partner be acknowledged? You know, again, I know today we're focused on women, but a lot of male same-sex parents maybe who are using surrogacy abroad and then accessing services here when they come back to Ireland and so on, they can get a very mixed reception in healthcare settings. So it's just, again, it's so important that people get trained and have access to education and knowledge around this issue. And then I suppose in terms of aftercare, so again, I think public health nurses are key, and then being their knowledge and skills and competence in this area are key, because I think people, same-sex parents, often feel, I suppose, undermined in pre and postnatal care and are reluctant to engage with services. So they don't engage in services in a timely way, and can, I suppose, then things can escalate, or they end up having to engage with services in an acute presentations rather than in time. And just the final thing to say then as well, you know, more and more people with trans identities need access to pre and postnatal care. And again, this is a very new and emerging space in Ireland. So really, please do, if you're working in that service, in those services, reach out to TENI or ourselves for training, because we have a lot of experience of training health and social care professionals in this space. So we'd love to go in and train and talk to you about it.
Yeah, certainly an important message there around being educated ahead of time. If someone's at a space where they are pregnant, they're preparing for parenthood, you don't want to be falling into an educator role at that vulnerable stage in your life. So really, as us, as the healthcare professionals, to take a lead on that and to use the services there like TENI and LGBT Ireland to help educate us if it's a shortfall that we have. That we need to work on. Just any of the other panelists want to comment on that section before we move to the next question, or is that okay? Is that clear enough? Okay. So just another question there around being LGBTI, and is that the reason for mental health struggles? Is it not mental minority stress which impacts upon the person's mental health, and maybe not assuming that it's mental health or wellness issues that people present to a mental health service are linked to gender and sexuality. So this person feels as a therapist it's essential not to ignore this integral part of an individual's personhood and culture. So Moninne, I see you've written down there, but you might just speak to that a little bit as well.
Yeah, I mean, excuse me, it's probably difficult to untangle it all and say, 10% is relation to this and 90% is in relation to that. Everyone is different. But I'd be surprised if somebody who's LGBT who presents with something that's going on, with the mental health issue, that's the trauma that they've experienced as an LGBT person hasn't in some way caused or added to the reasons that they're struggling at that time. It's endemic, it's everywhere, and we internalize it as well. So I mean, it's one of the reasons that we find coming out so difficult. And I think the older you get, the harder it gets in some ways, because for young people I'm not saying it's easy to come out when you're young, don't get me wrong. There's, it's in some ways it's very difficult because you're so dependent on other people. But I think the longer you wait, the more difficult it becomes, the more you build it up. And then you might have, work, you might have dependence. It can be really, really difficult, and you can build it up in your head. And sometimes some of that is, you need to be fearful of it, but sometimes it's stuff that, in my own case anyway, it thankfully didn't pan out. Things were much better than I had it worked out, but I struggled with, a lot of anxiety for a couple of years before I came out. So I think I'm not saying that, a bit like Lilith said, not everything is to do with your gender identity or your sexual orientation if you're struggling with a mental health issue. But I'd say it's likely that's a contributing factor, because our society even now is still consciously in some places and unconsciously in others built for people who are not LGBT. Our systems and our structures, our schools, our healthcare systems, all of those have non-LGBT people in mind, in the way the buildings are built, in the policies, in the language, in the practices. So we internalize that all the time. So you'd have to be a fairly robust person for not to take its toll some way or another.
Yeah, and speaking of all that, and maybe an example, and I'm curious to hear how the young people with media, there's recently been a TV program, Heartstopper, and I was struck by it that it was so banal. It's just about kids in school figuring out who they are, and I was actually struck, why is this so shocking? And maybe the experience contrast to the growing up is the director doesn't seem to be trying to kill off anyone. It's not like it's a sin. It's not like half traumatic to watch it as well. So I'm just curious how, like, these positive media representations that show the ordinariness of LGBT life, how is that received for people that use your service as well?
Yeah, it's so important. I mean, there was a time, back when, like, myself and Paula were young queer people, where any kind of representation was, you know, you were delighted, but usually they were, and excuse the colloquialisms, but mad, bad or sad, you know, and somebody had to die, or, you know, so there was always some tragedy. So I think it's lovely that it's just a, yeah, you know, well, as you said, that in that program, I watched it behind a cushion thinking, oh no, something bad's going to happen, something bad's going to happen, you know, and then it doesn't. And it's so lovely and so ordinary. And we need to see more of that, especially with trans characters, that they're just living their lives. They're just getting up in the morning, having breakfast, brushing their teeth, you know, going to work, blah, 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 going to school. That's the kind of thing we need. We need much more of that to make things less dramatic, and because most of us live, you know, less dramatic lives than that, thankfully. So it's a more realistic depiction, and for many, especially I suppose with trans characters, you know, it's such a small percentage of our population who are trans. So not all of us are lucky enough to have trans friends or family members. So, you know, some of us, it'll only be through the media that we get to see and learn about trans lives. And so that's why it's so important that we have more of this positive stuff, instead of this very negative villainization of trans people, because guess what? That's just not the reality. That is just not reality, you know. So more stories about ordinary folks and extraordinary folks. I mean, I'd love to see more stuff around history, you know. I love learning about LGBT history and amazing people who were so integral to Irish history, to the foundation of the state, for example, and to arts and culture. But that stuff gets erased when their stories are being told. So we're not told, you know, that sometimes the women are completely erased anyway, but from the history. But, you know, even if they do include women in the telling of the 1916 Rising, you never hear about their same-sex relationships, you know, or if we're telling the story, you know, stories about famous Irish people in theatre and stuff like that, you never hear about the fact that some of them were trans women, you know. You don't hear that kind of bit because it's just been erased, and it's really important that those kind of stories get told.
Absolutely, and in the biopsychosocial model of mental health, you know, even as healthcare practitioners, these things that are happening in society and media, they do bear influence, and so positive to have different role models and representations, because they can, of course, seep in. We are a part of a society. So I'm not seeing any other questions just come in. I'll give people an opportunity to type in any last comments, but I might just invite each of our speakers, if you have any closing comments you'd like to make, if anyone would like to come in there. So Paula, I might just ask you, is there any closing comments or anything that we haven't covered that when you were thinking of LGBT mental health and women?
Yeah, I think just building on what Moninne said there, I think around mental health, because we are as a community so much at a higher risk of having mental health difficulties, and I think it can be the root cause, like the bullying and the discrimination, the stigma can be a lot of what causes that mental health. And so having talks like this, challenging that in society, because it does matter. Do you know what I mean? I think because Pride has become so big and there's a lot of things happening, and sometimes I think if you're not LGBTI plus, you might go, well, why, you know, why is this got so big? And it does matter so much. So I think the other side of things, though, as well, is just to make the point again, which we talked about this morning, is that sometimes it can be the root cause, and sometimes it is that having our LGBTI identity will, because of that fear of rejection, we don't open up or fully engage with mental health services, because we are fearing a negative reaction. We are fearing that people will assume it's because of our identities. So just to share my own personal story just for a moment, and I think it's important to talk about our own mental health struggles and so on. So I had really difficult mental health problems when I was in my 20s before I came out. I hadn't come out to anyone. The GP sent me to a therapist, and I spent the first session just grilling her on her security measures around her records. And then eventually I came out to her, and then I didn't need to talk about it again for 6 months because I had other stuff that were causing my mental health difficulties that I had to deal with. But that was the moment where I began my recovery, in my opinion, because I could be my true self from the next session on. If I'd not told her in that first session, I don't believe I would have engaged. I wouldn't have continued to go. And she affirmed, and that was the early 90s. So I was probably lucky. But it wasn't actually my sexual orientation, even though I thought it was, that I had other issues to unpack. So that's the difference it can make, I suppose. It's about the access, and that moment is key. So again, and then I'll hand over to Lilith and stop talking. We've a lovely older person who speaks in our Champions program, and he was Access Mental Health Services for 20 years, and a nurse for 20 minutes listened to him and affirmed him being a gay man, and he walked out of a psychiatric hospital and he has never looked back. And that is the difference that a conversation can make. Now obviously he had journeyed up to that moment, but really he would, hand on his heart, say that mental health nurse changed his life. So that is honestly, they're small things, but they can change somebody's life. So that is my appeal to everyone on the call, is really engage in this if you can, because it can be transformative.
Absolutely, that allyship and hearing what people have to say. So just Liz, I'll invite you, and this question you might be able to best answer this as well, but there's someone here saying that they struggle a bit when people ask why trans people expect all kinds of medical treatments but don't identify as unwell. Any idea on how to deal with that question? How might you respond to that, or any of the panelists, any ideas on that one?
Well, if they say they're unwell, then they're probably not unwell, and it's the fact that they're a trans person and they're trying to access healthcare, and there shouldn't be an assumption that just because you're trans you're automatically unwell, and that and I also just wanted to kind of link back to, I think there was a question in and around kind of minority stress. Again, that is not something that somebody who's LGBT or trans, that is something kind of personal to them that they just need to sort out. Definitely there is an internalized element to that, but minority stress is brought about by the majority causing stress, and that's a societal issue. It's a systemic issue, and that needs to be acknowledged. I think that those are kind of aspects that need to be taken into account when dealing with trans people. But I think this is an issue, again, with the model of care that we have in this country. Being trans is an area of sexual health, in terms of accessing, say, hormones and surgeries. And trans people deal with a lot of crap in their lives, and they may need mental health supports for that. But we're in a situation that trans people are being denied their bodily autonomy because they're being told, well, you're too anxious, you're too depressed, you have we suspect possibly you might have autistic traits, and the list goes on and on and on. Why haven't you come out to this person and that person? Why aren't you doing all these things? And you have to tick off all these things, and you have to be the perfect this perfect model trans person, when really what should be happening is that your healthcare, in terms of your hormones and your surgery, if that's something that you need and you want, needs to be taken care of. And your mental health care then is something that complements your development as a person, and not used as a barrier or to gatekeep access to services.
Absolutely, yeah. And maybe any closing comments from yourself then that you would like to add into this as well?
Well, I think my colleagues have really covered everything. I mean, it's about making small changes to your own practice so that you can make sure that your own clients and people you come in contact with know that you're an ally and that you're safe. I mean, I can very much relate to what Paula said. When I was struggling, I went one step further. I found a therapist that was lesbian, so I didn't have to have those awkward questions. It was great. And that completely changed my life. But yeah, so I think practice changes, but I think it needs to go further than that. And I think, you know, to echo what Lilith was saying, I think as professionals, I think it's about educating yourself, educating others in your profession, and then as a profession, standing up for the changes that need to happen in society. We as LGBT people can call for change, can call for action. But we need allies. We're a small percentage of the population, and we need professionals in respective professions like the mental health profession to stand up with us in solidarity with us around the changes that need to happen legislatively and policy wise, in terms of conversion therapy, in terms of hate speech, in terms of bullying, all those things that you're coming across in your daily practice. Your expertise and the evidence that you can give can help bring around about change. So so yeah, I think there's many ways that people from today can hopefully bring some of that with them into their everyday practice and their lives.
Certainly, we've heard a lot of really tangible solutions and ideas there for mental health professionals and for all of us to take on board within our practice. And I suppose the last and most important question we have there is how we're going to spend next Pride weekend. Well, sure, obviously having a party and being very proud. Any other events that people have in mind? Of course, the big celebration then being in Dublin. I know that there's a trans pride as well, a special day also around that. So more information on the Women's Mental Health Network, it's in the chat bar there as well, and how people can be more involved. There's events throughout the year. I'd like to thank all our panelists, really invaluable contributions there, and I found it really helpful, and I hope the participants did also as well. So many thanks everyone, and happy Pride to you all.
Thanks, Linda. Happy Pride, everyone.
Thank you. Happy Pride,
everyone.
Thanks, Linda. I'll just give a quick couple of comments here at the end before we finish off. So just to say thank you so much to you, Linda, for doing such a good job chairing. Too good of a job. We'll be asking you back. You're going to really regret that one. And of course, to our amazing panelists, Lilith, Moninne and Paula. Excellent and really informative as always. And I think a lot of food for thought there. I think a lot of really good discussions on, you know, the wider context and the structural issues that still do exist. Lilith, you know, you mentioned kind of the issues within the healthcare system itself, the waiting lists and those kind of things that certainly in the National Women's Council we continue to work on, and we'll do our best there to try and be inclusive. But I think a lot of, you know, very important points about that there is still fear and anxiety around coming out and you know, being your authentic self. And I think it's really important for practitioners and services to really be aware of that, and, you know, as I said, not to make assumptions about anybody. And I think you've already highlighted the need for mandatory training in LGBTI issues for all services and practitioners. And I think just to finish off, the practical things that were shared, I think should be really useful for everybody in this call. So, you know, being visibly inclusive, whether it's having a rainbow or having, you know, leaflets with access to LGBTI services, you know, those kind of things that people know that they're in a safe space, and that, you know, as I said, it is visible for them. And language as well, just, we all make mistakes, and it's okay to make mistakes if you do misgender somebody or use incorrect pronouns, but just to make that effort within your practice and your service to be familiar with the different terminology and make sure that you are trying to use inclusive language, and again, not making assumptions about somebody's partner or their background when you're taking your notes. And you know, what we're trying to do here is ensure that people are aware of the services out there. So signposting to different services, you know, knowing where you can refer on to as well. So I just wanted to highlight that as we finish off. And as I said, I know that there's a lot of people here who aren't members of the Women's Mental Health Network. So I know Louise has posted some information there in the chat. So please do email me, or you can sign up on the National Women's Council website or the St. Patrick's website as well if you'd like to become a member. So just to say thanks again to all our panelists and our chair for a really great discussion, and thank you so much to everybody for coming. And last but not least, thank you to my colleagues in the Women's Mental Health Network, Alana Ryan, Louise O'Leary and Elaine Donnelly, for all their help putting this event together today. So thanks so much, and I hope everyone has a great weekend.
Thanks, Faye.
Bye-bye.
Bye.